Welcome to our channel. In this video, we'll explore ventricular tachycardia, focusing on monomorphic VT as seen on an ECG. We'll break down its definition, mechanisms, causes, clinical significance, and ECG features, so stick around for a detailed overview. Ventricular tachycardia, or VT, is a broad, complex tachycardia originating in the ventricles. The most common type, monomorphic VT, arises from a single focus within the ventricles. Sustained VT lasts longer than 30 seconds or requires intervention due to hemodynamic compromise. Non-sustained VT involves 3 or more consecutive ventricular complexes that terminate spontaneously in less than 30 seconds. Mechanisms of ventricular tachycardia. There are 3 main mechanisms behind VT. 1. Re-entry, the most common mechanism occurring due to conduction block in one pathway, often from myocardial scarring caused by prior ischemia or infarction. 2. Triggered activity, caused by early or late after depolarizations. Examples include torsades de pointes and digitalis toxicity. 3. Abnormal automaticity. This occurs when a region of ventricular cells generates abnormal accelerated impulses. The primary conditions associated with monomorphic VT include ischemic heart disease, particularly scar-mediated VT, dilated cardiomyopathy, hypertrophic cardiomyopathy, Chagas disease. Clinical significance. VT can severely impair cardiac output, leading to hypotension, collapse, and acute cardiac failure. These effects are due to the extreme heart rates and the loss of coordinated atrial contraction, also known as the atrial kick. In patients with poor ventricular function, VT can result in further cardiovascular compromise, decreasing myocardial perfusion, and possibly degenerating into ventricular fibrillation, VF. ECG features of monomorphic VT presents as a regular broad complex tachycardia. Key ECG characteristics include uniform QRS complexes within each lead, identical in appearance except for fusion or capture beats. Very broad complexes exceeding 160 milliseconds. Absence of typical RBBB or LBBB morphology. Extreme axis deviation, also called the northwest axis. Dissociation. P and QRS complexes appear at different rates. Additional features to look out for. Capture beats. Normal duration QRS complexes produced when the sinoatrial node transiently captures the ventricles. Fusion beats. Hybrid QRS complexes resulting from simultaneous sinus and ventricular beats. Positive or negative concordance across precordial leads, where leads V1 to V6 show entirely positive or entirely negative complexes. Josephson's sign, a notching near the nadir of the S wave. Brugada's sign, an RS interval greater than 100 milliseconds. The RSR pattern with a taller left rabbit ear is highly specific for VT, distinguishing it from RBBB, where the right rabbit ear is taller. Here is an example of predominantly positive QRS complexes throughout the precordial leads. Notice how all the QRS complexes in leads V1 to V6 are entirely positive without any RS complexes. Next, we have an example of predominantly negative QRS complexes throughout the precordial leads. In this case, leads V1 to V6 show completely negative QRS complexes, creating a QS pattern. Now, take a look at an example of Josephson's sign. This is characterized by a notching near the nadir of the S wave, a distinctive marker of VT. Finally, here is an example of Brugada's sign. You can see that the RS interval exceeds 100 milliseconds, further supporting the diagnosis of ventricular tachycardia. Example 1. In this case, the ECG shows very broad QRS complexes measuring approximately 200 milliseconds, all with uniform morphology. Additionally, fusion and capture beats are clearly visible in the rhythm strip. A defining feature here is Brugada's sign, seen in lead V6. The RS interval exceeds 100 milliseconds, confirming the diagnosis of VT. Example 2. Here, the ECG demonstrates a northwest axis, which is a hallmark of VT. You'll also notice a tall monophasic R wave in lead V1 ton paired with an RS complex in lead V6, a small R wave followed by a large S wave. This pattern is highly specific for ventricular tachycardia. Understanding monomorphic VT on ECG is essential for diagnosing and managing this potentially life-threatening arrhythmia. By identifying these key features, clinicians can take timely action to stabilize patients and prevent serious complications. Thank you for watching. If this video helped you, please give it a thumbs up, share your thoughts in the comments, and subscribe to our channel for more insightful medical content. See you in the next video.